Hey, how's it going? Hope y'all are having a great day. My name is Tex, and I'm answering a question that was put to me is, should I see a therapist? Actually, I have a more important one. Should you be listening to a therapist? And yes, you should. It's not just enough to go see somebody. You actually need to see somebody and talk about things. It's a whole nother talk. For the moment, though, the question is my problem to the point of where I need to see somebody if I need to see a therapist? Now, there's several ways to go about thinking about, do I need to see, and I like to rephrase this, see a professional to get help with a problem. See, a lot of times it comes down to whether or not reasonably you can expect to fix a problem. If you have something that's happening in your life, how do you want to go about dealing with it? I like to use the example of a car. Most people can get that one. If your car just needs a little air in the tire, you can go do that yourself. Now, you might ask yourself, why is the tire getting low? And then who knows? You might even be able to look at it and go, oh, see, there's a nail in there. Or you might not be able to see it. You might have to take it up to somebody and have the guy take the tire off the car and run it through the little water trough. If you've ever seen it, it's really cool, and they spin it around till they find where the bubbles are popping out and going, oh, see, there's your problem there. And you're going to need a plug or a patch, and they'll be the ones to do that. So sometimes in life, you have problems that even if you can find out where the problem is, maybe you can't do anything in particular to fix it. Or maybe what you can do is not enough to actually address the problem. See, you can also take that same flat tire scenario, and if you was to go to any one of the auto places, you could buy those little cans of Fix-A-Flat, which has got this gooey stuff in a can and a lot of compressed air. You can pop it on your tire and put it in, and it will temporarily slow your leak problem, but it may not permanently fix it. This is where we get into a lot of our situations where we find temporary fixes to our problems that really doesn't fix the problem. It just sort of puts a band-aid on it, or it hides it. Maybe and I do find there's a lot of people who will see their primary care provider, and the primary care provider will talk to them, and they will have anxiety or depression or something along those lines, and the primary care provider will give them a prescription, what I call a band-aid in most cases, to help deal with the problem temporarily. And the good doctors will tell them this will help you until you can get a professional, a therapist, a psychotherapist, a counselor, and take a second look at this problem. Because this kind of problem that maybe it can be fixed without you actually having to take medication, but we got to get you to that point where you're there and you're taking it. Now, if the question is addressed in general and you're looking out at either someone in your family, maybe one of your kids, maybe a loved one, boyfriend, girlfriend, spouse, stuff like that, or you're even thinking about yourself, I like to break it down into what I call the 4Ds. This is something that I got when I first got into psychology in general, was an explanation of what makes something, at least from a psychological standpoint, more of a problem that we need to consider. Okay, because there's deviance, which means changing from the norm. There's distress, dysfunction, and dangerous. Now, I start with deviance because sometimes things that are different are not necessarily bad. You know, I come from the South. I hold doors open for people. I say, yes, ma'am, no, ma'am, yes, sir, no, sir, because that's what I was raised to do. And down south, that is the norm. When I come up north and I say that, then sometimes people look at me when I go, yes, ma'am, or no, ma'am. Or when I hold the door, maybe that ain't always the norm in an area. So a lot of times, deviance is specific to the culture or area or even time that you're in. Now, why is it important? Well, if everybody's doing it, even if it's distressful, it's not maybe something that you want to get help for. Maybe it is. I think it is, but other people say maybe not. Because maybe all the kids in school are staying up late and not getting their homework done. If that's the norm, it's hard sometimes to go against it. I don't think it's healthy for you. But again, so this is where we're breaking down things. Now, when we look at the other part of it about distress, is it hurting you? Or is it hurting someone else near you? Sometimes you have problems, and the problem is not causing you any distress. Maybe you're perfectly happy staying up till 2 or 3 in the morning and playing your music loud and all that. It don't bother you at all. Maybe you can even, because the job you got, you can sleep in late. There's no issues for you. But the other people in the house or the neighbors might be a lot of problems. So you're distressing other people. Dysfunction. If something isn't working, come on, people. It doesn't get much simpler than that. If you're telling me, "Oh, I never do my homework. I always do it right before I get up and go to school in the mornings, and that way, that's what I do." Okay, if it works for you, awesome sauce. If it ain't working for you, rethink it. Okay. A lot of times people will do things and say, "Well, this is what I've always done." And I'm like, it ain't working. It's not functional. If it's not functional, consider trying something different. Okay. So then we get to dangerous. Something that is dangerous could be a thing, an activity, or anything you're doing that brings you or somebody else harm. So deviance, driving on the wrong side of the road, it now becomes danger. So see how now we're having a problem. It's getting out. Now, if you're deviant because you always drive in the right hand lane, you don't ever speed, and speeding is the norm. You're never in a hurry, which is great. Most people are always in a hurry. You've deviated from the norm, but you're not dangerous in any way, unless you've deviated to the point of where you're going 40 miles an hour in a 65 zone and traffic's packing up behind you. Now it's become dangerous. Or even if you always drive in the left-hand lane, but you keep up with traffic and you don't block anything, it's okay then to drive in the left-hand lane. But if you drive in the left-hand lane and you're doing real slow speeds, people have to pass you on the right, which is dangerous. So you start to see how these things add up to say something's not right. Now I'll give you examples how this works in life. You suddenly find that you don't have that oomph in the mornings. You're not getting up, and going in the same time every morning, or you're getting ready last minute, and then you don't know why. It's just not the same. Now maybe it's a family member or coworker points out and goes, hey, dude, when you come to work, you don't seem the same, or you're showing up last minute. You're not prepared. Okay, something's not right there. You need to back up and go, hey. Sometimes it's a case of where you're overusing coping skills that are not good coping skills. Taking a nap can be a good coping skill when you're tired, but sleeping all the time, okay, now it's getting out of whack, especially if the sleeping is now messing up your nighttime sleeping and you're staying up during the night, and then see how things start to cascade. Okay. And do you need to see somebody? Everybody can use a little help every now and then. Now, sometimes the somebody you see may not be a full-blown therapist. Maybe it's one of your buddies that you talk to when you're down. That's okay. Understandable. Great. And as long as it's working and getting the job done, awesome sauce. On the flip side, if you keep talking to people and you're literally to the point of where people are avoiding you because you keep coming to them and talking to them and it's something bad, but you're never doing anything different. See, now you're distressing the people around you. Friends are there to help, but they're not the end all do all. Maybe it's something sleep, like your sleep issue. Maybe you just go see a doctor and the doctor says, hey, and straightens you out, says, no, you need to start doing this, and this. Good sleep hygiene. A lot of times therapy comes in when there's something emotional or psychological that's hidden in the background that's changing things. Okay. And I'm not talking about the extremes. There are some cases where it's something biological and you need to see a doctor and you need to see a therapist. I'm talking about just your average run of the mill problems and issues. Now, sometimes you can function perfectly well on the outside with a long-term problem like dysthymia. That's that long time, low grade depression. You might be able to get up and go to work. You might be able to do your schoolwork. You might be able to get through your day, but life has lost its zest. So it is distressing you and it's not functioning very well. So go see somebody. Now, if it's something seriously dangerous, you need to see somebody quicker. See, if you're having a problem with drugs or alcohol and it's getting dangerous, then you might want to seek a program for that. If it's something where you're having thoughts of suicide, see how the danger is escalating up, then maybe you need to talk to somebody quick. If the thoughts of hurting yourself or suicide are getting very, very bad, oh yeah, you need to go do something about it right away. You may even need to call 911 if you're thinking about it now, or you're dangerous, a danger to yourself because you're thinking about hurting yourself, or if it's another issue with anger and you want to hit somebody else or hurt somebody else. When it's somebody in your family, you look at it and they're not the same person. They've changed. Something happened. Now, sometimes these things change because of the normal cycles of life. Sometimes they change because of life-altering events like COVID. Sometimes maybe there's a death in the family or separation. Sometimes when parents get separated or divorced, it helps to have the kids be able to talk to somebody. Okay. Sometimes you as an adult, when you go through changes in life, maybe you had a job change. Maybe your worries are starting to bother you and plague you every day, and you're having problems with sleep. You're having bad dreams. It keeps going on and on and on. As this happens, then you start considering, maybe I need to get help to get back on track. See someone to take that edge off so I can start back coping again. Okay. If you're taking any medication for depression or anxiety from your primary care doctor, you really should be seeing a therapist. Now, I'm not saying that you're going to keep seeing a therapist, because maybe you see a therapist, you get the most good out of it, and then you have a condition that doesn't let up, and you might need continued medication management. And it isn't necessary that you see a therapist on a regular basis, but it's nice to have one in your hip pocket. That way, when something happens and you take a big hit, you go back and talk to the therapist. So now you've got those ideas of when something's wrong and you need to see somebody. The mere fact that you question, do you need to see somebody, is a red flag. If your days have changed and you don't get zest or life out of them, you need to see somebody. Now, I'm going to put a link down below, but there's a site that has a couple of questionnaires, and I'll talk about them quick. These are standard ones that most mental health professionals use. It gives them a gauge of how you are currently feeling, like within the last 2 weeks. So one of them is the GAD-7, GAD-7, and it has 7 questions, and the 7 questions pertain to things that are more along the lines of anxiety. How many days in the last 2 weeks did you spend worrying about, things? How many days did you spend worrying about a lot of different things? How many days in the last 7 did you have this fear that something awful was going to happen? How many days were you irritable? Okay. And the scale, when you look on it, you'll see there's, no days, several days, then it bumps up a little bit to half the time-ish, and then close to or every day. And as your symptoms level goes up, then it goes from a minimal to a mild to a moderate to a severe rating. And a mental health professional can help you with that. Uh, the thing is, though, is when you look at it and you start moving to these scores of mild and moderate, then odds are in the last 2 weeks you've had a problem. Now, don't be like some people I know that try to figure a way to weasel out of the questions. Well, you can't count the last 2 weeks because I had this happen, or you can't count the last 2 weeks because I had a job change. You can't count me being irritable that day because somebody else's, it was their fault. They got in front of me and slammed on their brakes, or there was a bad car accident, or I fell and hurt myself. People drop the bullshit. Quit finding excuses to not give an honest rating. Okay? Work on it. Get the score. Figure out where you stand. It's not the same as seeing a professional, but if it will help you think, heads up, I definitely do need to call somebody. The PHQ-9 is a similar test, and it measures the sadness or depressive type symptoms. And it asks questions along the lines of, how many in the last 2 weeks, how many days were you feeling, down, sad, depressed? How many days were you having a problem with your appetite? People go, what does that have to do with anything? It has a lot. Because some people will eat more when they're sad or depressed, or they won't eat at all because the sadness makes them not hungry. So you're looking for changes in your norm. Not being able to sleep or sleeping too much. And then, of course, the last one has to do with thoughts of hurting yourself or even of suicide. So when you have those thoughts of death, that is a big warning flag. I'll take just a second to go through that briefly and say that I've never met anyone who's never thought of death or never thought of even their own death in the sense of, well, what would the world be, without me? Or you hear people make these off the wall comments like, it's just not worth it anymore. Sometimes it's not serious. Sometimes it's serious passive thoughts of death. But then sometimes when they're persistent, you need to take a heads up. You need to look at this. Definitely, if you are thinking about hurting yourself, if you have a plan, if you intend, if you have means, and by all means, if you've done it before, you've tried to kill yourself before, and you're thinking about it again, please seek help. And in this case, you may actually seek out crisis, called the crisis line, the crisis text line, even calling, if you have to, if you're by yourself, calling 911, going to the emergency room. Okay. But I think that the question more in the line that people were asking me of is do I really need to go see a therapist? I'll say you need to see somebody. And I'll say you probably need to consider seeing a professional if your symptoms have persisted. In other words, if you just had something happen like you lost a job, you got separated from somebody you've been dating, maybe you're having a downer, okay? And in the past, you go seek out some friends, you hang out, maybe you play some video games for a few days, or you go hang out with friends during the day and watch movies. Maybe if you're really sad, you binge watch something on Netflix or TV of some sort or whatever. That's all cool. I got that. Thing is, though, is when it persists, when it lasts, when it's worse than it was before, when it's starting to hurt you, when it starts causing you problems at work or in your home life or your relationships. You feel yourself getting behind. You feel things changing. And maybe you don't feel them because they're so slow and they creep up on you, but the people around you notice them. The people around you say something. So those are all warning signs that you need to start thinking about what you're going to do and how you're going to do it. Seek out a therapist, counselor. Maybe your church, if you go to a church or if you go to some religious organization or group, sometimes they have professional helpers and counselors within that organization. Sometimes at work, you have the EAP, the Employee Assistance Program. You seek out those people and, you go see someone. There's lots and lots of different options for help. And I'll talk more about the different kinds of therapists and about how to pick a therapist for you in my next video. But right now, just know that you may need to see somebody, and the best thing you can do is at least check it out. It's no different than, if you hurt yourself and you go, oh, should I see a doctor? Oh, you've been limping around for 2 weeks. Don't you think it's time you went and asked what was wrong? Maybe you need an x-ray. Or in the case of mental health, maybe you need an evaluation or an intake to find out where you're at and where you stand. So you do those things to find out how you're doing. There's nothing wrong with asking for help. In fact, I consider people to be more mature and more intelligent when they know when to ask for help. It's no different than your car. Putting air in your tire, you might be able to do that yourself. But changing your tire, if you haven't done it a lot, maybe you need to ask somebody. You call somebody, hey, what do I do with this tire thing? Changing the brakes. Unless you got a real good buddy who knows how to do that, you trust them with your brakes, think about it, then maybe you need to take it to somebody who professionally changes brakes. You wouldn't be ashamed to ask for that. Why would you be ashamed to ask somebody, I got these problems going on in my life. Do I need to see somebody? Okay. And the therapist will talk to you and say, this is what we see. These are your options. These are possible diagnoses. This is what we can do about it. And if it's something that they think is really serious, they can say, hey, you also need to, go see the psychiatrist and talk about medication because maybe you need medication to get over the hump. If you're taking medication, though, you need to see a therapist. Medication's your Band-Aid. Therapy is the way to get to what's causing the problem. Okay? Again, I use the car analysis. If you look at your tire and your tire's getting kind of wore on the edge, yeah, you can change that tire all you want. But you and me both know until they pull it up and find out that maybe, just maybe, your alignment's off, you're going to keep chewing through tires. So why not get the alignment fixed so that you quit chewing through tires? Why not do the therapy so that you get a handle on the problem and handle it without a constant need for a medication? Okay? Sometimes problems flare up and go down, flare up and go down. If you see that happening, don't just keep hoping it'll go down again. No, work on the problem so that it doesn't keep flaring up. Or if it flares up with less intensity. Okay? Hope that answers your question. Like I said, to wrap it up, you have some resources online to take and look. There's a whole lot of places to go. Those two that I'm giving you, those two little connections will link you in so that you can look at that PHQ and that GAD and take the exam and kind of get an idea. There's lots of other websites. The fact, though, that you have to question, is your problem big enough to see a therapist, is probably an indicator that you might need to see a therapist. Okay, especially for things that have been long-term, that you've been dealing with for a while. If it's someone in the family, then talk to them and going, hey, I noticed this, would you consider seeing somebody about that? Okay? Hope you have a beautiful day. Take it easy. Have a great weekend. Thank you now.